neurophysicians. They come in later. Snoring actually per se is a marital or a social problem. Snoring with apnea or hypopneas is a medical problem. So anybody who is snoring has to go through a sleep study before we can say whether they have apneas or hypopneas. When you mean apnea, it is a total obstruction to the airway, but when you say hypopnea, it is 50% or more the airway is obstructed. So when it comes down to apnea and hypopnea, we say that it is a medical condition when it lasts for more than 10 seconds and occurs more than 5 times per hour and 30 times per night. We all know that apneas could be obstructive, central or mixed, and that the obstructive sleep apnea, it is obstructive. But we need to keep in mind that whether it is central or mixed, these patients require ventilatory support.